It's hard to imagine what could be scarier than waking up in the middle of your own surgery. Probably only the feeling or seeing the process by yourself is scarier than that. Hi there, this is Infinity, and today I'm going to tell you about people who woke up during surgery. Simon Rosenqvist. A young man from Sweden named Simon Rosenqvist has become the victim of an unexpected awakening during a surgery. Immediately after his rehabilitation last March, Rosenqvist sued the hospital for failing to provide him with optimal sedation during his lung surgery. Simon was conscious for 35 of the 50 minutes of surgery. The dosage of anesthesia in modern medicine is pretty precise. Sometimes doctors deliberately reduce the dosage of anesthesia during the surgery because they try to avoid a sudden decreasing of the pulse of the patient. However, the anesthesiologist always closely monitors the heart rate. If the rate suddenly becomes excessively high, the dose of drugs is increased again. However, in Simon's case, no one increased for some reason. Donna Penner. In 2008, 44-year-old Donna Penner was hospitalized in Canada. The woman needed a laparoscopy, a surgical procedure in which an incision is made in the patient's abdomen to examine the abdominal organs with a view to determine an injury or a disease. It's considered a fairly simple surgery, and the doctors were not worried about the patient's health. Donna, on the other hand, was very worried, and it turned out she had her reasons. Before the surgery began, the anesthesiologist measured out the necessary amount of medications, put an oxygen mask on the woman, and ordered her to take deep breaths. Donna fell asleep, and the surgery continued as normal, except that the patient woke up much earlier than planned. According to Penner herself, she woke up and realized that the surgery was just beginning. The first words she heard were the surgeon's phrase, "Scalpel, please." Donna couldn't warn anyone about her awakening. Even though she regained consciousness, she still couldn't move or even open her eyes. She had to spend the entire surgery listening to what the surgeons were doing behind the curtain.
I think you're going the other way. Going the other way? No, now you're doing
It's
it well.
hard to imagine what Donna went through in those moments. Fern Settle. Fern Settle was about to undergo a routine appendectomy. However, as in Donna's case, the anesthesia did not behave as intended. Fern ended up waking up right in the middle of the surgery and immediately felt suffocated, a feeling that was caused by the breathing tube the doctors had decided to use during the surgery. But the worst of all was the pain in his abdomen, which the man clearly felt. According to Settle, he tried to get the doctor's attention, but all to no avail. Like Donna, he was completely paralyzed. As the patient told reporters, he lost consciousness again during the surgery. When he regained consciousness in the recovery room, the doctors began to assure him in one voice that it was just a dream and that there was no way Settle could have woken up during the surgery. But who's to be believed then? Fortunately, a special investigation was ordered that uncovered an error on the part of the hospital staff. An inexperienced nurse had mistakenly entered in the medical record not the patient's actual weight, but the weight which was 18 kilograms less. Based on this wrong data, the anesthesiologist calculated the dose. No wonder Fern woke up right in the middle of surgery. However, the hospital avoided serious consequences. The case was settled before the trial, and the man received several $1,000s and an official apology as compensation. A relatively small price to pay, considering that later Settle had to go see a psychologist and suffered from nightmares and panic attacks for over a year. What could be worse than feeling the surgery process? Maybe seeing the surgery process by yourself. There are many more interesting and creepy stories further, so stay tuned, but only if you're sure you have strong nerves. Miles Brazil. Most surgeries, whether under local or general anesthesia, are performed using a special tissue curtain that separates the patient's face from the area where the surgery is being performed. But such a technique is not always possible. In 2018, a man named Miles Brazil woke up while undergoing throat surgery at St. Mary's Regional Medical Center. Brazil's case was complicated and highly unusual. The man inhaled a valve cap of the wheel of his bicycle. The valve cap was stuck in his throat and Miles began to suffocate. The man was taken in critical condition to a nearby hospital where doctors decided to immediately begin surgery to remove the foreign object. Miles was in such a state that he could not warn the doctors about the fact that he'd previously had problems with anesthesia. However, he tried. To be precise, he needed a much higher dosage of anesthesia than a person of his weight and age should have. The doctors didn't hear Miles' warning, and as a result, he felt absolutely everything during the surgery. It's impossible to imagine what a man who was fully conscious during the surgery on his own throat could have experienced. The man himself could not even find the right words to describe what he was feeling. The fact that the surgery was very short could be considered a relative plus, but there was also a huge downside. The surgical intervention was of no avail. The doctors didn't manage to remove the valve cap, so Brazil coughed it up on his own after a few days in the hospital. Sarah Thomas. Patient Sarah Thomas has also suddenly regained consciousness during surgery. Sarah wanted to get rid of her tonsils. She said she felt pain immediately, but was unable to give any sign to the doctors that she was conscious. It took the nurses a full 15 minutes to notice that something was wrong. It turned out that doctors had simply run out of anesthesia. There was no liquid in the container that was pumping the drugs into Sarah's vein. How is this possible? Normally, the amount of medication is monitored by a special device that alerts the doctors when a critical level is reached. In Sarah's case, this sensor malfunctioned without anyone noticing it. Of course, as soon as the problem was discovered, the nurses rushed to give Sarah an extra dose of anesthesia, but the damage had already been done. After the bad surgery, Sarah suffered from panic attacks for months. According to Richard Marks, a professor at the Royal College of Physicians, what happened to Thomas happens about once in every 19,000 cases. The reason for such incidents are always different. Anyway, as a result of the trial, the woman was awarded $25,000 compensation. But can money compensate that nightmarish experience? Bradley Hay. The next story is even worse. The culprit here is not technology, random coincidence, or physiology. It's no secret that medical drugs often have a pronounced effect on the psyche. This is a shortcoming that medical professionals have to put up with, but it also attracts a huge number of fans of banned substances to the black market. This time, however, there was no black market, but that didn't make Bradley Hay's case any less scandalous. Instead of giving a patient a sedative, the doctor decided to give it to himself. The negligent anesthesiologist who misappropriated the sedative received an overdose of the drug that day. But was this better for the patient who woke up during a major surgery due to the doctor's negligence? The fate of the dreadful doctor is unknown to this day. We can only hope he got what he deserved. Chloe Khan. Chloe Khan is a professional model. During her career, she had to undergo various plastic surgeries more than once and more than twice. During one of them, everything went so wrong that the girl not only woke up in the operating room, but also lost her ability to smell as a result of a bad procedure. According to the girl, she was not told what exactly went wrong during the surgery, but from the very beginning it was clear to her that it would not end well. The girl could not breathe through her nose for 8 months and was forced to live with painful memories. It's a good thing that eventually everything went back to normal. 11 Irish patients. A recent study showed that of all patients who underwent surgeries last year in Ireland, at least 11 regained consciousness during a surgery. It appears that there were many more such cases than official statistics have claimed in recent years. The researchers counted more than 300 cases in which doctors noticed in time that the general anesthesia given to the patient simply didn't work. But what's most striking is the mystery that shrouds this problem. 300 cases a year is a huge number for such a relatively small country as Ireland. Alexandra Bithell. Alexandra Bithell had to undergo appendectomy, a simple surgery turned into an event that divided her life into before and after. Waking up during the surgery was not something the woman wanted to experience. She heard the medical team discussing her and her condition in a rather cynical manner. Alexandra heard the instruction, "more morphine," after which she fell back into sleep. After the surgery, Bithell began asking doctors uncomfortable questions about her awakening, but they only shrugged and said about visions during the anesthesia. That's all, guys. How do you think it's possible to make up for these doctors' mistakes? Let me know in the comments section down below. And if you liked the episode, subscribe to the channel, press the like button, and don't forget to stay notified of upcoming videos.